Hi, my name is Dhalia Masud and I'm a plastic and reconstructive surgeon. And today we are going to talk about one of the most important decisions you may face after a breast cancer diagnosis. Should you have an immediate reconstruction or should you delay it? Now, this isn't a simple decision, and importantly, there is no right or wrong answer. What I want to do today is to give you a clear, honest, and balanced understanding so that you can make a decision that is right for you. So, what do I mean by immediate versus delayed? Now, I've done a few topics on this before, but let's start with the basics. An immediate reconstruction is when your breast is reconstructing at the same time as your mastectomy. So that's when we remove your breast. So you go into surgery once, you wake up with a breast shape already there. And a delayed reconstruction is when you have your mastectomy first, and then you return months or maybe even years later for a reconstruction. Now, both approaches are completely valid. The decision depends on multiple factors, and no two people, even though they might have exactly the same background, will come to the same decision. So we'll go through the details of how we can help you make the right decision. The most important thing I tell all my patients is you must be sure you want the reconstruction. It's not a small decision. This is surgery that will affect your body for the rest of your life. So take your time in making the decision. Try not to feel pressured about it. Sometimes when people are diagnosed with breast cancer, everything moves very quickly. Now that's a natural pressure to make the decision fast. And some patients feel, I don't want to wake up without the breast. I just want everything done at once. And these are completely valid feelings, but we need to take a step back and we need time to think and say to yourself, I'm not quite ready yet. So let's see what the key drivers of the decision process is. One of the biggest factors in deciding is timing. One of the key decision factors in deciding on the timing is whether you need radiotherapy or chemotherapy. Radiotherapy can be pretty important and can significantly affect your reconstruction, particularly if you are having implants, but also when it comes to using your own tissue, it can cause shrinkage, hardening, increased risk of infection, and what we call fat necrosis, which is lumpiness of the fat as it slowly melts away. Now, this doesn't mean that you can't have a reconstruction if you need radiotherapy. It just means that we need to prepare you for the potential outcomes. And many patients actually do very well. But the key point here is being prepared. If we know in advance that you need radiotherapy, then we can better plan and prepare expectations. Chemotherapy is also a consideration. If complications do occur, there is a small chance that your chemotherapy may be delayed. Now, this isn't common, but it's something we take into consideration. The other important factor in deciding your reconstruction timing is your health and your overall optimization. Now, these include things like smoking, your BMI or your weight, your diabetes status, and other medical conditions. Now, if you are having an immediate reconstruction, we don't often have as much time to optimize you or prepare you. And when I mean optimize, you don't often have enough time to improve those other illnesses or factors that can have an adverse outcome to your reconstruction. Now, if you have a delayed reconstruction, because we have time between your mastectomy and your reconstruction, we can help you stop smoking. We can improve your fitness and we can stabilize your medical conditions. This can significantly reduce complications and significantly improve outcomes. And there's also the psychological consideration. This is something that is often underestimated. Many patients worry about the waiting period with delayed reconstruction. They think, gosh, I don't want to wait 1 to 2 years. But in reality, that time is not just waiting. You are recovering from your mastectomy, which is a big deal. You're going through further treatment potentially, and you're adjusting emotionally. You're also learning about all your other options for reconstruction in a timely manner without feeling pressured and without being too worried about knowing what the next cancer step will be. And this is a massive benefit for people who go for delayed reconstructions. The other thing that you need to be aware of is your family around you. Now, it can sometimes be a lot of pressure to do everything in one go, particularly if you need family support, and splitting up the surgery by doing the mastectomy first and the reconstruction at a later date can allow your family as well as yourself to adjust to the whole system and the process of having surgery. And interestingly, studies show that patients who choose a delayed reconstruction often feel more prepared, which is understandable. And interestingly, they have a higher satisfaction rate. But again, it's really important to have an individual decision. And the delayed reconstructions tend to have a higher satisfaction rate because they have had that significant amount of time to think things through carefully. So let's talk about the pros and cons of an immediate reconstruction. What are the benefits? Well, it's one operation, one anaesthetic, and one recovery period. You've got the bulk of the reconstruction out of the way. You wake up with a breast shape, and there's an avoidance of being psychologically without the breast. But the downside is there is pressure to decide quickly. The outcomes can be affected by radiotherapy. Now, not everyone will be sure 100% whether they need radiotherapy before the mastectomy. And some people, they have a surprise where we find, although we weren't expecting radiotherapy, that they need radiotherapy. And in these cases, there is that difficulty in preparing them mentally and physically for the potential outcomes of radiotherapy because of the short period of time. There is a slightly higher risk of complications if you are not optimized medically in terms of weight, in terms of health, and particularly smoking. And those who are smokers, who have a higher BMI, we know that these patients, they have a higher risk of complications, such as infection and wound breakdown. So what about delayed reconstructions? What are the pros and cons? The benefits are you have time to make a confident decision. We have the ability to optimize your body, and the cancer treatment is completed first. We have better long-term planning, and as I've already said, there is better satisfaction rate. However, the downsides is that you have to have a period without a breast. You have a second operation, which requires a second period of time out, a second period of you psychologically facing your diagnosis again. And also it impacts on you socioeconomically in terms of jobs, so having to take a second period of time out from work. And there is also different scar patterns when you have an immediate versus delayed reconstruction. Again, I've done a couple of videos in the past with this, but if you have an immediate reconstruction, you tend to have a round scar where we can create a nipple in the middle of the round scar that more matches the native breast or the breast that you had. And if you have a delayed reconstruction, you have a scar across the chest. Now, for some people, this may not be a big issue, but for some people, this scar difference can be significant enough to affect the outcome cosmetically. So final thoughts, how do you decide? Ask yourself, am I ready for the reconstruction now? What treatment will I need? And can I commit to the recovery? Do I want time to think? Now, recovery is incredibly important. An immediate reconstruction where you are doing your mastectomy and your reconstruction at the same time, the recovery period is significantly longer because you have to add the reconstruction recovery. And if you are having the DIEP reconstruction, that can be 12 weeks after the surgery that needs to be added on to the mastectomy. And you'll be in hospital for longer as well. Whereas if you have a mastectomy on its own, for a lot of cases, this can be done as a day case, and you'll need a few weeks to recover rather than a few months to recover. And splitting up that recovery period can be a massive benefit for some people. The best decision is the one that fits your life, your body, and your journey. And remember, you do not have to rush this decision. If you're considering breast reconstruction and would like a detailed consultation, we will be happy to help. If you found this video beneficial, or if you know someone that is going through a reconstruction decision-making process, please like and share this video, and hopefully it will benefit them too. Take care, and I'll see you in the next video.